Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. So let's start today's session. Prevention is the key focus of public health. It is cost effective and beneficial not for only the individual but the whole population as well. So today our topic of discussion is levels of prevention of diseases. Before going to the main topic, let's discuss some terminologies. First is disease. What is disease? Disease is an alteration in body functions resulting in a reduction of capacities or a shortening of the normal lifespan. Now, what is the difference between disease and illness? Disease is a physical or mental dysfunction that reduce our capacity or shorten the normal lifespan. And what is illness? Illness is the awareness of the disease when he or she is aware that he or she is not well. It is called illness. And what is sickness? Sickness is a social dysfunction that I am recognizing that I am not well, that I am ill. And for that, today I am not able to go for my work. So I am taking a sick leave. So that is a social dysfunction that I am not going to work today. I am not taking class in the college. I am in sick leave. That is a social dysfunction. So sickness is a social dysfunction. So this is the difference between disease, illness and sickness. Disease is a physical or mental dysfunction. Illness is when we are aware of our disease, that is illness, and sickness is a social dysfunction. Next is risk factor. Risk factor is a variable that increases the likelihood of developing a disease, disorder or other problems. Just for example, we can say age can be a risk factor, like school-aged children are at risk of communicable diseases. Or genetic factor can be a risk factor, like family history of diabetes predisposes a person to developing a disease. Or any physiologic factor like obesity increases the possibility of the heart disease. Or some health habits like smoking increases the probability of lung cancer. So these all are the risk factors. And other risk factors like the lifestyle of a person, like very much pressure, work related pressure increases the stress, and this stress can be a risk for many other diseases like diabetes, heart disease, like this. And environment also can be a risk factor, like hazardous environment or poor sanitation may contribute to diseases. Next, coming to what is prevention. So prevention describes approaches and activities that stops the development of progression of disease or its impact. Preventive activities can vary depending on diseases. So we can classify the levels of prevention in 4 types: primordial prevention, primary prevention, secondary prevention and tertiary prevention. Let's discuss each type in details. Primordial prevention, it is a prevention of the emergence or development of the risk factors in countries or population groups in which they have not yet appeared. That means here action is taken prior the risk factor arises. So risk factor is not emerged yet, but we are discouraging or preventing the risk factor before that. As an example, we can say a father telling to his 10 years old child that smoking is injurious to health. The child is 10 years old, he didn't smoke, but the father is giving him advice that discourage the harmful habit. Don't smoke even after you grown up, because smoking can cause lung cancer or heart disease or other respiratory diseases like this. So when the risk factor is not present, but we are taking some good habits or preventing something, like we know that obesity can cause heart disease. So before the obesity arises, we are taking balanced diet, we are doing exercise. So this is the primordial prevention. And this primordial prevention can be achieved by individual education or mass education. We know individual education. Here we see that the father is telling to his child that don't smoke, it is injurious to health. The child didn't smoke, but the father is giving information to him that smoking is injurious to health, so don't smoke even after you grown up. So it is an individual education, one-to-one education. And in mass education, in example, we can say in the school authority organized a mass education, a health education program regarding uh, harmful effects of tobacco for the students in class 5, 6, like this. So here the students who are in class 5 or class 6, they didn't smoke, but the school authority is giving this mass education for that these child should know what is the harmful effects of smoking. So when they grown up, they should discourage these practices. So discouraging the harmful habits, they are giving mass education. So next is the primary prevention. Primary level of prevention is applied when a risk factors are present but disease has not yet taken place. So action taken prior to the onset of disease, which reduces the possibility that a disease will ever occur. So we can say primary prevention is a concept of positive health. What is positive health? An acceptable level of health that will enable every individual to lead a socially and economically productive life. So as an example of primary prevention, we can say, we all know obesity can cause heart disease. So obesity is the risk factor here and heart disease is the disease condition. Okay. So I am a person who is obese, but I don't have any heart disease. So here the risk factor is present that I am an obese person, but the disease is not present. Heart disease is not present. I didn't have any heart disease. So here what is the primary prevention? The primary preventive measures are for putting my weights down, for reducing my weight. I am doing exercise regularly, I am taking balanced diet, and I am trying to be fit. So this is the primary preventive measures. Primary prevention can be achieved by health promotion and specific protection. What is health promotion? Health promotion is the overall improvement of health by modifying your lifestyle, diet, doing regular exercise, taking balanced diet, maintaining hygiene, cutting off the harmful habits, environmental protection like this. And specific protection includes the protection against particular diseases like immunization. We are taking immunization for protecting us from some specific diseases, that we are taking COVID vaccine to prevent COVID. We are taking BCG to prevent tuberculosis. We are taking uh, polio vaccine to prevent poliomyelitis, like this. Or some supplements. Like we know, iodine deficiency is a major problem globally, major public health problem. So experts decided that iodization of the salt may be the simplest and most cost effective way to prevent this problem. So we take iodized salt to prevent iodine deficiency. And most of the health programs comes under this specific protection. Next, coming to the secondary prevention. Secondary prevention is the halts the disease before it get complicated. So it is applied when disease has possibly set in, that is attempts to arrest the disease process and treat it before it become irreversible. So secondary prevention starts after the disease appeared, but in the early stages. And by this secondary prevention, we can stop the progress of the disease. It can be achieved by early diagnosis and treatment. Suppose a patient comes with breast lump. So early diagnosis can be done by doing the screening test, breast examination, mammogram, ultrasonography, MRI, like this, to diagnose that this breast lump is a breast cancer. And for that, the early treatment should be started. There are different treatment strategies: surgery, chemotherapy, radiation, like this. Here the patient comes with the disease, that is the breast lump, and in secondary prevention, we after the disease appeared, we started the preventive measures, but in the early stage. So here the patient comes with breast lump, and then the early diagnosis and treatment started to stop the cancer cells to spread. Next is tertiary prevention. Tertiary level prevention signifies intervention in late pathogenesis phase. It is applied when disease has advanced beyond early stages. The goal of it to reduce or limit impairments and disability and minimize suffering. It can be achieved by disability limitation and rehabilitation. Disability limitation is it prevents the transition of disease from impairment to handicap. As an example, we can say physiotherapy in case of paralysis, or resting the limbs in neutral position in paralysis to prevent deformity. And what is rehabilitation? It is the training and retraining of an individual to the highest possible level of functioning ability. It can be medical, vocational, social, or psychological. Example, using of artificial limbs in case of amputation, that is that is balancing, gait training, how to take care of it, how to use this artificial limb, like this. Or using crutches after poliomyelitis. So these are the rehabilitation. If this video is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.